Hello and welcome to the channel. Today I'm going to be talking about joint pain. Joint pain is quite a common problem for women going through perimenopause and even in the post-menopause years. The main reason for this is generally the big drop in estrogen that happens at this time of your life. Estrogen does so many good things for a woman's body, and one of the things it does is to act as an anti-inflammatory around the joint area. So if you have less of it, then you can have a problem with your joints. Then there's also old injuries. It might not necessarily always be the drop in estrogen, because if you've got old sporting injuries or old injuries from accidents, obviously as you get a little bit older, these things can get a little bit worse. Then obviously wear and tear as well over the years. Our joints, they really take a pounding, so they're going to get tired and a little bit worn out like the rest of us. So it might not always necessarily be the drop in estrogen, but quite often that is the main reason why women at this time are suffering problems with their joints. So obviously, apart from the pain, you may get swelling, general aching and stiffness, which is going to be really uncomfortable and make getting everything you normally get done difficult, because if you're in pain and you're stiff and your mobility is affected, then it's going to make life rather hard. So you can do a few things to help make things a little easier. Over-the-counter painkillers, you could have a word with your pharmacist to see which ones they recommend. That can help, but definitely ask for the best one. You want to target a specific kind of pain, so get a little bit of advice. You could also soak in a warm bath. Don't have it too hot, obviously. Hot flushes, night sweats, and also it is drying for your skin. But a nice soak in a warm bath, that can ease the aching and stiffness. So that can help, particularly in the evening before you go to bed and you want to feel relaxed and comfortable. You obviously don't want to be in pain. Making sure you get enough omega-3 fatty acids in your diet is really important for your joint health. Now, you can get this from oily fish such as sardines and salmon, but if you don't eat fish, you can also get them from things like kidney beans and walnuts, and flax seeds are a very good source of omega-3. So it doesn't always have to be oily fish, but make sure you get enough of it in your diet. It's really beneficial for your joint health. Massage as well. If you massage the sore joints, that can help ease the pain and stiffness. You can use aromatherapy oils for this if you would like. There's lots of different ones you can get that are suitable, but always make sure you dilute them properly and follow the instructions. And they generally smell lovely as well, which is nice. Magnesium oil spray is my personal favourite. I use this myself and I found it absolutely brilliant. So not only is it alleviating the pain, soreness and stiffness and aching, you're actually getting some of that magnesium into your system, which is really important at all times of your life, but particularly for women at this stage of their life. And while it's an oil spray, it's like a dry oil. It is not greasy at all, and you apply it directly on the offending area. Massage it in and it absorbs, and it really does make a difference. You can get a lot of relief from using that. I have actually written a blog about my experience of magnesium oil spray, and there's a link to that in the description of the video. And another thing that is really important as well, you do need to take gentle regular exercise, which might sound a bit odd if you're sore and stiff and your joints are really hurting. But it's a way of keeping them moving gently. Obviously, you don't want anything high impact, but if you keep them moving, it helps them to lubricate themselves and to loosen up, and it actually has a beneficial effect. You'll find that you suffer less pain. I know you're probably thinking, it's going to make it worse because I'm using the joint more, but if you don't use it enough, then that causes pain in itself. So there's just a few ideas there. I hope you find them helpful. If your joint pain is becoming really, really painful and you are really losing your mobility, or you are worried, or the swelling isn't just slight swelling on occasion on your joint, then please go and see your doctor, because there are treatments that they can give you. Because if you actually have arthritis, then you do need some help with that. I hope you find the tips helpful. Give them a try. If you would like to know when I'm putting any more videos on the channel, then there's a notification bell below the video, and there's also a subscribe button too. Thank you for watching, and I'll see you soon.